Thanks. So yeah, if anybody has comments throughout then, feel free to interrupt me as I'm talking, since we have some more flexibility with time. So I'll be talking about substance use among people that are involved in the legal system. I think I said this at the beginning, but I do research with justice involved populations. I do a lot of work with stigma and other sorts of barriers that impact populations like that that are involved in the legal system or who have a history of substance use problems. And so this is something that I am really passionate about and like to present on. So thanks for having me. All right. And I can't see the chat while I'm presenting, but hopefully if anybody has a question that you could someone can tell me. All right, I don't have anything to disclose. So today I'll talk a little bit about just some of the ways that people with substance use problems intersect with the legal system and what that interaction looks like, and then also some of the evidence-based treatments that have been examined for folks with substance use problems in this sort of population. So it might not be a surprise to anybody here, but the United States incarcerates more people than any other country in the world. So our incarceration rates, these numbers are a little outdated, but they haven't really changed that much over the years. And when we think about what that actually looks like on a daily basis, we know that almost 12 million people are entering correctional facilities every year. That doesn't mean they're staying there very long, but just entering through the criminal justice system. 1 in 47 adults are under some form of correctional supervision at any given time, which means they could be incarcerated or on community supervision, where they're meeting with a probation officer regularly or something like that. And we know that once people enter into the criminal justice system, they don't stay there. They don't often stay there for very long. And it's rare for somebody to stay there their entire life, right? Most people, 95% of people are being released back into the community after they have been incarcerated. So the idea that, you get arrested for breaking the law and you go to prison or jail and stay there, forever is just, we know that's not true, that mostly everybody who goes into that system is coming back out and rejoining the community. We do also know that it's really challenging for people to kind of get back on their feet, so to speak, get their life back on track, do what they need to do to have a successful life after they have been incarcerated. 62% of people are rearrested within 3 years of being released from incarceration, and 71% are rearrested within 5 years. So those numbers are really discouraging, and it says that something is really challenging about being released from incarceration. We know that people tend to struggle a lot with getting things back on track after they've experienced incarceration. So when we think specifically about who is getting incarcerated, right, because that's where I'm a psychologist, and I became interested in this sort of work by thinking about who's actually going into this system. We know that a lot of people with behavioral health problems end up in the legal system. So substance use is incredibly common among people that are arrested and incarcerated. 63% of people that are incarcerated in jails meet criteria for a substance use disorder. When you look at state prisons, it's more like 50% of folks that are in prison meet criteria for substance use disorder, compared to much lower rates in the general population. So we see kind of this heightened prevalence of substance use disorders that can diagnosable disorders among people that are getting arrested. And so when we think about what this connection looks like, so why do people with substance use problems often get involved in the legal system? It's not hard to make that connection initially because substance use is illegal. So we know that simply using certain substances or possessing them is illegal and can get someone arrested and incarcerated. But there's also other ways that people who have substance use problems can wind up in the legal system. So we know that intoxication is one of those mechanisms. Sometimes people do reckless or illegal things while they're intoxicated, and 40% of people report that they used drugs at the time of their offense that they got arrested for. So we know that there's that sort of mechanism there. Also, people sometimes engage in illegal behaviors to get money that they can use to purchase substances. 21% of crimes are committed to obtain drugs. That's just a statistic from the Bureau of Justice Statistics. And we also know that the last mechanism is through the environment that people are sometimes involved in when they are using substances. So the more kind of people that you associate with that are engaging in illegal behavior or substance use, that's kind of considered an antisocial environment. The more immersed in those environments you are, the more likely you are to become arrested or get arrested and become involved in the legal system yourself, just kind of by the nature of those sort of environments and the types of activities that are going on. So there's a lot of ways that people can become involved in the legal system. We know there are some major mechanisms there. And once people are involved in the criminal legal system, they get arrested, they go to jail or prison. We know that having that history of substance use problems puts them at risk of actually succeeding when they get out of that system. So people with a history of substance use problems are more likely to have to get rearrested once they leave. A lot of that is tied to relapse that occurs after they are released, or returning to substance use after they are released from jail or prison. And when we think about specific substances, there's some differences here. So we know with heroin that the risk is really high. If somebody comes into jail and they've a history of using heroin, their risk of returning to heroin use and also getting rearrested after they get out of jail is particularly high. And then for other opioids too, we know that simply getting arrested and having that sort of period of incarceration where people don't have access to substances, they lose some of that tolerance they may have had to the substance prior to incarceration. So that reduction in tolerance during the incarceration period can really increase someone's risk of a fatal overdose when they are released. So there's been some really eye-opening studies showing that in that 2-week period after people are released from jail, they have an incredibly high risk of fatal overdose from opioids, which is part of why we have so many efforts to try and look at the way we treat opioids in the criminal legal system. So what can we do to try and address substance use within this sort of unique context of the legal system? Well, there's been a lot of research looking at that because substance use is so disproportionately overrepresented in the legal system. So there's been a lot of research basically taking what we know to be evidence-based treatments in other settings like outpatient or residential substance use treatment settings, and testing those sort of approaches with people that are involved in the legal system, whether that's during incarceration or with people that are on probation. And we know that in general, most of the substance use treatments that we have that we know are pretty effective for people in other settings are also effective for folks that are involved in the legal system. So the kind of typical list of evidence-based approaches like motivational interviewing, cognitive behavioral therapy for substance use, contingency management, medication-assisted treatment, those sorts of approaches have an evidence base with populations that are justice involved. When we're thinking specifically about medication-assisted treatment, methadone has the most, the highest or the largest amount of evidence behind it. Other sorts of approaches, other medications have been examined, but not as often as methadone, and the results are sometimes mixed. Like, for example, some of the results for naltrexone and whether that is effective for people in reducing return to use and reducing recidivism, the evidence is more mixed for those sorts of medications. We also have some not new, but like different kind of unique treatments for people that are involved in the legal system. So drug courts are one of those types of treatments. And these are, drug courts is only one type of court, specialty court that the legal system uses. There's also treatment courts, problem-solving courts. And basically these are diversion programs that people can take part in instead of being incarcerated. So if someone gets arrested and it's pretty clear they have a substance use problem, maybe they are arrested, when they're arrested, they're intoxicated, or it's clear that they have this history of substance use problems. They can, instead of just going to jail and sitting in jail for however long, waiting to be sentenced and kind of going through that standard legal process, they may instead go through drug court, which allows them to go in front of a judge who's familiar with substance use treatment, get an evaluation to see what kind of treatment they need, and then get referred to the type of treatment that they would benefit from rather than going to be incarcerated. So those sorts of approaches have a lot of support behind them. We have some really cool ones here in Tennessee. We have the 10 Rocks program, if anybody is familiar with that, the Tennessee Recovery Oriented Compliance Strategy, which is in several different judicial districts here, and basically takes people that have addiction problems and allows those folks to get connected into treatment rather than just going to jail. So those are good for a variety of reasons. First, the diversion aspect is really nice because people are able to get connected to treatment rather than going to jail when their legal problems are mostly prompted by their addiction. That can be really helpful. And yeah, so I mean, that's one of the biggest reasons those are helpful with the drug courts. And so like the treatment courts, for example, you might see those used for mental health problems when somebody's arrested and they have the evidence of a mental illness that contributed to their offense. Same sort of idea there, but the diversion approaches are really nice. The other one is the therapeutic community, and some of these are more common in prison settings, which prison, people go to prison typically for more serious offenses and they're there for a longer amount of time. And so therapeutic communities are sometimes used in those settings to create sort of separate people with substance use problems from the rest of the population in the prison and basically create this kind of therapeutic environment within the prison where people can get treatment for substance use. Therapeutic communities often involve peers, people with lived experience that are also in the prison system, who can kind of, help support people who are trying to get treatment for substance use. And the most effective ones start during incarceration and actually extend post-release, though they don't always do that. Not all prison systems even use this approach or have the ability to have that continuity of care, but many of them do, and those tend to be the most effective. So we have all these treatments, these evidence-based approaches that we know do tend to help people with substance use problems, even when they are justice involved. But we do see rates that are a little disturbing with how many people in the legal system actually receive any sort of behavioral health services, specifically substance use treatment. SAMHSA does they do kind of nationwide surveys on this pretty regularly of what kinds of treatment people receive and how many people in the legal system are receiving behavioral health treatments. And a good portion of people who are justice involved are not getting treatment for substance use. And so we have these effective approaches that we know help substance use, but many people are not receiving them. So that led me in a lot of my work to be interested in what are the barriers to people getting access to these services and why aren't we using them more often in the legal system? So some of the barriers to receiving substance use treatment in general, we know stigma is a barrier to substance use treatment just in general, not even considering specifically the legal system, but it's particularly relevant for people that are involved in the legal system because not only do they have the stigma of having a substance use disorder, which we know is highly stigmatized across settings in the community and the healthcare system, but they also have the stigma of having a criminal background, which is very, very highly stigmatized and pretty much across the board in the US. And so when I say stigma, I just refer to any sort of characteristic or aspect of a person that is judged negatively by the rest of society. So substance use and criminal record are two examples of stigma. Other examples are living in poverty or having a mental illness, other sorts of, having HIV. There's all sorts of different examples of characteristics or aspects of a person that can be stigmatized. Those are just a few. But when we think about people who are involved in the legal system and who have substance use problems, we see kind of we see a long list of stereotypes that the general public holds about this population. So here's just a list of some of them, and these have been gathered by research studies that poll the general public and just ask, what do you think about people who have substance use problems? What do you think about people who've been to prison or jail? And these are some of the most common stereotypes that are applied to folks that have substance use problems or criminal involvement in their history. That they're untrustworthy or unreliable, they're dangerous and unpredictable, that they're weak-willed, that they don't have self-control, secretive, manipulative, that they're to blame, that addiction is a choice, that they're unlikely to recover, they're unlikely to benefit from treatment, they have poor character. There's all sorts of stereotypes. These are only the most common ones. And the research shows that stereotypes are more intense for pregnant women and people who inject drugs, and then also people who've engaged in sex offenses. These sort of stereotypes are even more kind of intense or severe for those subpopulations. But these are some of the ways that the general public thinks about folks who have a history of substance use or criminal justice involvement without even knowing that person. These are some of the stereotypes that come to mind for that group. And so stigma is important to talk about, especially when we're thinking about the criminal legal system, because it creates a lot of barriers to people getting access to substance use treatment that they really would need and could benefit from, and that could keep them out of the legal system. So we know that there are a whole host of structural barriers, like certain medications or certain treatments just not being available in jails or prisons. So somebody could come in with an opioid use disorder and simply not have access to treatment that would benefit them. So structural barriers like that. And then there's all sorts of other impacts of stigma on the folks that have these sort of histories of substance use or criminal legal involvement. So we know that it's really common for people who are in groups like this, who have these sort of histories that they might be ashamed of, to feel a lot of stress, anxiety, depression, to feel like they are being rejected by others in the community, even if that isn't true objectively. They often perceive that they are rejected because of their history. And we see a lot more of avoidance behaviors, withdrawal, and social isolation among people that are in stigmatized groups in general, including folks with these sort of histories. So specifically in the legal system, we know that a lot of barriers are present, not just stigma. So we see that, stigma is a big part of it, of why programs aren't even available in these sort of systems, but it's bigger than that. There are a lot of barriers that are unique to the legal system. A review that I did a couple of years ago, we looked at reentry programs and kind of wanted to see, what are different programs including in their reentry programming, like what types of substance use treatments are, included in reentry programs. And we found 34 reentry programs that we found in the scientific literature, and 21 of them provided substance use treatment, whereas 13 of them just facilitated connections to other sort of treatment settings. I should say reentry programs are programs that people can engage in as they are leaving incarceration and going back into the community. So many of them just facilitated connections to other sort of substance use treatments and didn't actually provide substance use treatment. And then out of the 21 interventions that we found, the substance use interventions that we found, only 12 of them identified using an evidence-based approach. So there was a lot of the reentry programs were using things like psychoeducation as their primary substance use treatment. There was a lot of kind of vague descriptions of programs as being self-help. So sometimes it's not really clear what the program involved when you're looking at the literature later, but only 12 of them identified like an actual evidence-based approach that has that we could kind of understand, like cognitive behavioral therapy or motivational interviewing or something like that. We also know that, so a lot of these types of programs for people that are involved in the legal system are maybe not including evidence-based approaches, but there are a lot of reasons for that. There's a lot of barriers that legal systems face. Treatment costs money, and it costs, time and staffing and resources that a lot of legal systems do not have. Especially if you're thinking about during incarceration, a lot of times the jails just don't have the capacity to hire people who can provide evidence-based treatments or who are qualified and trained to provide those treatments. And there's other sorts of barriers as well. So like contingency management, for example, A lot of folks in the justice system, there's been studies showing that they don't really want to provide rewards to people or, that are in the legal system. And that ties back to stigma and some of the ways that we think about folks that are that get arrested. We see this sort of attitude. It's been identified in many different studies that a lot of the times people that work in the legal system don't think that folks need treatment. They think that folks should be able to, just stop using on their own and use their willpower to get their addiction problem under control. And they don't view the legal system as a place where treatment is really valued in some cases. So those are all major barriers. Specific to medications for opioid use disorder, this has received a lot of attention lately with all of the emphasis on the opioid epidemic. We see that a lot of legal systems have major concerns about providing medications. There's a lot of stigma specifically surrounding medications for opioid use disorder, a lot of views about medications being drugs themselves that people can get high off of, thinking that people who take medications are not actually in recovery. There's a lot of kind of misconceptions and beliefs about medications specifically that make it difficult to offer those sort of treatment approaches in the legal system. And with medications, there's also a whole host of other issues like, how do you get the medications into the facility, regulations that apply to the medications, facilities having to be licensed to be able to provide medications. And then there's a lot of concerns about diversion and people, being able to give the medication to their cellmate. I was just working with a local jail around here that's considering adopting some medications into their facility. And there's just a lot of these concerns, the same ones that have been identified in the literature for many, many years that criminal justice staff have about these sort of treatment options. So it's a very real barrier to the legal system providing evidence-based addiction care. So one thing that's important to mention is that there's been a good amount of research showing that even when even when the legal system mandates people to receive substance use treatment, it's called legal coercion. It might be mandated as part of somebody's sentence that they receive treatment and that they go to treatment. Even when you do that, people do benefit from that sort of treatment. So even if somebody is court mandated, legally coerced to get into treatment, they are able to benefit from it. So that shouldn't be something that deters us from offering treatments in the system. And there's some research showing kind of what are the predictors of engaging in court mandated treatment. If the consequences are higher, people are more likely to engage and follow the court mandates. And also if they have sort of family, cases that are pending, like DCS cases, that tends to also increase people's engagement in court mandated substance use treatment as well. Which is not surprising because if people, if DCS is saying in order to get your kids back, you have to go to treatment, most people that have lost their kids really want to get them back. And so they're very motivated to do that. So one of the newer, major, it's a training at this point called the sequential intercept model or sequential intercept mapping that's being rolled out by SAMHSA across the US, basically shows how the legal system functions, and it helps different communities, different agencies like jails or probation agencies or prisons identify, where are we offering substance use treatment and where are the gaps in what we're offering. So it kind of walks through these different intercepts, intercept 0 being, or intercept 0 and 1 being where people kind of initially get contact with law enforcement or get arrested. Intercept 2 being incarceration or initially being detained. Intercept 3 is after serving their sentence in jail or prison. Intercept 4 is being when they re-enter the community. And then intercept 5 is when they're being supervised by parole or probation out in the community. And so, the evidence is really showing that to offer evidence-based addiction care and high quality addiction care, we need to touch all these intercepts, and we need to make sure that people are getting access to care at different points in this sort of process. in the legal system and try to enhance the continuity of care between these different intercepts. Like we can't just offer services in jail and then nothing when people get out. We've seen that if people just get something in jail and then they get out and they have no services or support, they're likely to return to use. We can't just offer things when people get out, because if we didn't offer them medications while they were incarcerated and we had them go through this aversive detox period off of methadone, they're not likely to get on it when they get out. So there needs to be this continuity of care between these different intercepts and diversion from this whole system when possible, because if we can just take people out of this system and get them connected to care when they have a substance use problem, that tends to be really effective. So in conclusion, people with substance use problems are very likely to have legal system involvement. It's kind of, it's easy to see how those things kind of intersect. And we talked about those mechanisms for how people get involved in the legal system. And while we have effective treatments for substance use disorder, there are a lot of barriers that prevent these sort of approaches from being used in the legal system. And so that's all I've got.